Hello, everybody. Welcome to the episode 8 of Let's Talk Health. Today, we're going to talk about coronary bypass, but not just coronary bypass, but life after coronary bypass. We have none other than Dr. Amrinder Singh, Senior Consultant, Cardiovascular and Thoracic Surgeon. He's going to give us a glimpse about himself, please. Let's talk about yourself in the first, sir, and then if you can give a little bit of a heads up in a journey about how you have reached here, please.
Namaskar. My name is Dr. Amrinder Singh, and I'm based in Hyderabad and working as a senior consultant cardiothoracic and vascular surgeon for the past 15 years in Hyderabad and in South India almost for the last 20 years. And I finished my cardiovascular training at SGPJ Lucknow. And after that, I worked in Amrita Hospital, Cochin, and now in Hyderabad for the last 15 years. So handling all sorts of adult cardiac surgeries, pediatric cardiac surgeries, and thoracic and all sorts of complex vascular surgeries also.
Yeah. Thank you very much for taking your time for this interview, sir. But talking about the topic today, can you give us a little glimpse about what coronary bypass is all about before we talk about how the life after coronary bypass is all about, please?
Sure. So every organ of the body requires blood to support. Blood brings oxygen, glucose, and all other things to proper functioning of the body. And this work is done by the blood pumping of the blood is done by heart. But heart is a structure made of mainly muscles, and it requires also blood supply to itself so that it can function properly. And this job is done by three coronary arteries. One is left, which divides into two major branches, which is known as left anterior descending artery, and second is circumflex artery, and right coronary artery. So these three branches of the heart supply blood to the heart itself. When some blockages happen to these branches, so the supply of that blood of that area of the heart is hampered, and because of that, there are various symptoms happens. Symptoms, if only the blockages are not very critical, not very significant, then it may present as a chest pain, jaw pain, neck pain, or left arm pain. Some patients have symptoms of gas trouble also. They present to us with gas trouble, but actually they are having heart symptoms because of the reduced supply of blood to the heart itself. And if this blockages become critical and more than they become 100% blocked, it can cause damage to the heart, and which leads to malfunctioning of the heart or dysfunction of the heart, which leads to sometimes they present as breathlessness, especially in diabetic patients, because these patients they don't suffer pain also most of the time, so they can present as breathlessness or with palpitation, in like increased perception of beating of the heart, or sometimes present at syncope, meaning faint, temporary fainting can also happen with these things. So for that, there are various modalities of treatment for this condition, and sometimes medical management is enough. Sometimes the cardiologists do percutaneous interventions in the form of stenting, and they put springs to open those blocks inside your heart, which is known as stents. And many times we need, if the blocks are multiple and if you are having diabetes and all three arteries are involved, in that sense, the best form of treatment is coronary artery bypass surgery. In this coronary artery bypass surgery, we do, it's like somewhere road is blocked, then we can go take another road to bypass that block and go to our destination. Same thing, the block is there in the arteries, which the blood cannot flow directly through them, so we create another passage in the form of grafts, and so that we literally bypass those blocks and supply the required amount of blood to the area which are distal to the or downstream to the block. So this is the basic sense, the coronary artery bypass surgery. The idea of taking this topic today is because most of the patients feel that this is the end of the story and they just have to undergo this surgery, and after that they just relax and they don't have to do anything, or they cannot do anything. That's the not idea of this surgery. The main idea of performing this surgery so that you can go back to your life, reclaim your life, have a second inning, you can support your family, you can work also, and you can do all sorts of activities without any fear of any impending doom. So that's why we have chosen this topic today.
Understood. But as you said, there is a lot of taboo that is surrounded by the coronary bypass. So we are really happy that we chose this topic. But can you tell us how much recovery time is required after the surgery?
For a normal patient without any complication, if the generally 2 to 3 weeks is required, but there is no bed rest. Only for 2 to 3 days till patient is there in ICU, we generally keep them on bed. But after once they are out of ICU, even in ward, we encourage the patients to move in the corridors, in the room, go to toilet himself, and do all sorts of activity. Once they are discharged in 5 to 6 days to their homes, they are encouraged to be active all the time. At least in their waking hours, they should be sitting, reading newspaper, doing physical activities, some activities which are being talked to them during their stay in the hospital by the physiotherapist and all. But overall recovery takes around 3 weeks to 6 weeks time.
Okay, great. So, is there any lifestyle changes that the patient has to undergo after the surgery?
Yeah, definitely. See, this operation, the disease process is still there. We are not removing the disease process, which is the idea of which is the process of having block at that thing. The process is still there, so that can affect over the period of time your new grafts which which put on those arteries. They can also develop further new blocks over the period of time, maybe 5 years, 6 years, 10 years down the line. So we need to, because as I said, it is a second chance, so we have to utilize this chance fully. 50, 60 years back, there was no chance of like this available to persons of that era. So we have to understand that this is a bonus given to us. So we have to take that advantage and thank to our Almighty for giving us second chance and utilize this chance. So definitely there are lifestyle modifications needs to be done in terms of your exercise level. We encourage patients to walk regularly, not a very fast walk or nothing, just normal speed walk, and they should be finishing and it should be start gradually, and they should be finishing at least 4 kilometers in 45 minutes daily, or at least 5 times a week. So that gives them that gives heart as well as body enough exercise to maintain itself. Then second changes come in the form of food. The food habits, they have to rest depending upon whether you are diabetic or non-diabetic. Diabetic especially, they have to control their diet, and if they are non-diabetic, we encourage them to take everything, but with the moderate quantities. There should not be any excess. Weight, if your weight is on a higher side, you have to cut down on your weight because your heart cannot sustain that kind of weight. And these are the activities and modifications you need to do after the bypass surgery.
Understood. But previously you have mentioned that it takes around 3 to 6 weeks based on the patient's health for the recovery. But for how much time does it require for a person to get back to the normal life, like running, exercising, or how much time does it require for a person to go to work again?
Sure. So as I mentioned, we never ask patient to take bed rest. There is no bed rest in heart surgeries. We always ask patient to move initially, because There are chances of sometimes reduced blood pressure because of some medications and all those things. So we ask the patient to move inside the house or in the compartment building or lawn inside their compound, accompanied by somebody. And then after 15 days, they are encouraged to go out and at least start walking, start with 10 minutes every week, increase by 5 minutes, so that by the end of 3 months, you should be walking at least 4 kilometers in 45 minutes time. That should be the your aim to achieve a good cardiovascular health. And recovery time is like going back to work. It all depends upon your psychology most of the time. If you are having a positive psychology that yes, there is some problem, there is a solution, we'll take the solution, we'll go back to work, and as soon as possible, that is the best way. And most of our patients who are non-manual, means labor, if they are working some teaching faculty or some desk job they are doing, they can go back to their work in 6 weeks time. And so persons who are doing some physical works like manual work and which involves some kind of lifting of objects or something, they have to wait till 3 months. The reason why we are insisting of 3 months is because if we are going through the median sternotomy, the bone takes around 2 to 3 months time to heal properly. So if you do lift the things early, you will have some pain. It won't damage you, but you will feel pain and unnecessary suffering will be there. So that's why we ask the patient who are doing some physical work there to resume their work after 3 months. They can go to farming, they can do their manual job, everything they can do, those kind of activities. So
Got it. So, although we have discussed about how much time it takes to go after work, but let's talk about during the recovery period also, like the 6 weeks period. There's going to be some pain or discomfort. How do you think the patient can manage that?
generally, pain subsides after 1 week of surgery. Sometimes some patients, some younger patients who are in their 40s and 50s, they feel more pain. Fortunately, our older generation of patients who are more than 60 years, they suffer little less pain because I think life teach them a lot more about pain. So for those patients, we ask them to take analgesic tablets, and we usually prescribe which are less harmful and all those things. Please consult your doctor before taking those medications, but we usually just prescribe some medications which they can take once or twice a day depending upon their need for to alleviate that pain. So some discomfort will be there because every surgery has some recovery period, some aches and pains and will be there, some numbness will be there. But generally in 2 to 3 months of time, everything just settles down. And once your heart starts pumping blood properly, all other organs of the body, they also start working very properly. You will feel hungry. Most of our patients, 90%, more than 90% of our patients come back at least 5 kg weight gain within 3 months because the heart was not functioning properly. So the blood supply to the gut was not proper. They were not able to digest the food properly, muscle weakness and all those things. So generally, all patients, they usually gain weight after the surgery because the heart is functioning properly. So all other organs also works properly.
Right, that's actually an interesting fact. But after the 3 months also, does the surgery come with any long-term restrictions or any limitations on the lifestyle?
No limitations from as far as we are concerned. There is no, after 3 months, we encourage you to go back to your work. You can drive two-wheeler, three-wheeler, four-wheeler, whatever you are comfortable with. And even walking, running, even after 3 months, you can go back to gymming also if you are weightlifting and all those things. So from your family life also. So from our side, there is no restriction on climbing of stairs or anything like that. So after 3 months, virtually there are no restrictions. Restrictions all lies in your mind. If you find that you have to follow these things and all, that's fine with you. But from our side, you can do anything, whatever you want.
That's great. Is there any medication that's supposed to be followed during the recovery period or after the recovery period? How long? Something about that, please.
Yes, it is like maintaining. We buy a house and then we maintain that house by regular cleaning that house and painting this house and doing some repair work and all. So this like same thing. We have to take the medication to initially there are little more medication, but so they will help the heart to regain and to regain strength and to function properly and do the various things. Initially, we give antiplatelet drugs which thins the blood, and so that your the artificial, not artificial, but the grafts which we provide to for them to function properly. Then we give heart rate controlling drugs. If you have blood pressure, then we give anti-hypertensive drugs. Food drugs are given for your diabetes. So these drugs which are mandatory, and then drugs are given for to maintain your cholesterol levels to optimum. So these are the drugs which are, or patients are sometimes they are taking thyroid drugs. So we continue the patients on thyroid drugs and all. So these drugs are there, and you have to take them as a maintenance dose for a quite long time. But these are few. They are not many. And after 1 year, we reduce the number of antiplatelet drugs. In initial phase, we give 2 drugs, but after 1 year, we come back to only 1 antiplatelet drugs, which thins the blood, and reduce the other things depending upon your requirement. So some drugs will be there, but they are not many.
Okay. So you had also mentioned regarding some dietary restrictions for both diabetic and non-diabetic patients. So can you just tell us a bit more about the dietary restrictions on how long people have to take that? Some glimpse about that, please.
Yeah. So for diabetic patients, as we say, the dietitian in the hospital will tell you before discharge what kind of food and at what time, and the quantity of that food is required for you. So they will guide you, and they will modify those food things to your local customs, based on your local customs and your regular habits. It's not like that we have to take oats or cake. Those kind of fancy items, whatever locally, how the local produce is there, or whatever your cultural beliefs are there, we take all considerations and advise you regarding that. So for non-diabetics, we don't have any restrictions. Only restriction is oil. Means oil. Any oil is good. Any oil is good. I'm again telling. Only the quantity which makes the harm. If you are using in moderate and less quantity, any oil is good. It's not like that olive oil is only, means there is a fad among our society that olive oil is best for health and all those things. In our Indian, if we see our Indian cooking, olive oil also becomes any oil as soon as we heat it for at high temperatures. So we ask you to cut down on oil. Second thing is red meat, because red meat contains cholesterol. So we ask patients to cut down on red meat quantities. But if you are having once or twice in a month kind of situation, you can relish the dish, not in a great quantity, of course. So white meat is good, like fish and chicken. You can take those things. Include a lot of green vegetables and locally produced fresh fruits, not coming from Washington and New Zealand and those kind of things should be avoided. So it's not like they are always fanciful names and all. Those locally produced bananas, guava, and papaya, watermelon, muskmelon. These are very good fruits which are most of the time locally produced and locally available also. And depending upon the seasonal fruits. In diabetics, the fruits we ask them not to, citrus family fruits they should avoid, because they contain a lot of instant sugars.
Yeah.
Like oranges, and then we have grapes, and then sweet lime, and custard apple. So these things, sweet fruits, mangoes, they have to avoid those things. They can take little apple and guava, they can take papaya, they can take watermelon, they can take. So these type of, yes. So for diabetics, these are good fruits. Okay. For diabetic patient, they should take more of a means whole wheat atta and whole brown rice. Prefer this all sorts of. Previously, we used to call them mota anaj, but these are very good like jai, bajra, and jowar. So these foods which have low glycemic index, they are very good for diabetic patients.
Got it. So this actually has given us a lot of information. But I'd like to give you one last question. So even after the surgery of the coronary bypass, what are the heart problems that can come, or how to prevent them so that the whole thing doesn't get a repetition?
As I mentioned earlier, that the graft is there, graft we have put, but disease is still there. So it might progress. It might progress to other areas of those arteries. It might progress to the grafts which we have put on your heart. So they also develop block. So if we follow these, we take dietary modification, we do lifestyle modification in form of exercise, diet, proper sleep, and proper fresh vegetables, fruits, and all. If we include the progression, we can at least delay the progression. They will come. That will come, as we have seen. Our former Prime Minister Dr. Manmohan Singh had undergone bypass surgery 3 times. So it can be delayed. So the best part is, because this is the only operation, bypass surgery, which prolongs your life also. No, it won't just not give you relief from your angina or heart pain. It increases the life longevity also of the patients. The main example is in front is Dr. Manmohan Singh only. So if we follow these modifications and these advices, take their medications properly, we can delay the second operation or second intervention on your heart.
Okay. So can I ask how many bypasses a patient can take?
It doesn't goes like that, but generally this operation lasts for around 10 to 15, 20 years, and with the practice of taking more arterial grafts, the longevity increases of this operation. So after I think 15 to 20 years, the interventions are required either in the form of re-bypass or in the form of some stenting or other procedures.
Understood. So thank you very much. I think we have addressed the major taboo mostly around how people can start, or how you said this, we can start the second innings of our lives even after this. This is not the end.
Sure. This is not the end. This is just the beginning.
Exactly. So I'm sure we will talk more about it eventually, but I'm happy that we have addressed the taboo, the elephant in the room, that there is no end after a coronary bypass, and there is always a second innings to it. So thank you so much for your time. We are pretty sure that the audience would have found this to be really informative. So thank you again for watching. We'll see you on the episode 9 of Let's Talk Health.
Namaste.
So thank you, and that's it for today for episode 8 of Let's Talk Health. I think we have basically covered most of the facts we have to know about life after coronary bypass. We have nothing stopping us, and also the second innings of our life. So let's meet you again in episode 9 of Let's Talk Health. Stay tuned.